Greetings. Now let us talk about how to set up a procedure in an endoscopy unit. Once you enter the procedure room, the first step is to make sure that the work area is clean, and if not, take time to disinfect all the surfaces that anybody could touch. Then you ask the endoscopist what procedure is he or is she planning to do and what endoscope do they require. You go to the scope storage area and pick up the scope and bring it back in a clean scope container back to the endoscopy procedure room. The next step is to set up the back table, the tech prep table, and what all you need, let us go over it step by step. There's a lot of stuff that is used during endoscopy, and here is a table full of all the small pieces of equipment that are required to set up the scope. First, let us look at the different buttons that you need to pick up and attach them to the scope. The red suction button, the blue air water button, the biopsy cap, and the auxiliary water jet connector. So these are all the buttons that you need to attach to the scope. Next, a bite block to keep the patient's mouth open during EGD, a large towel that is placed under the patient's head for support, lubricant, a small gauze on which you place the lubricant for ease of use, a small towel or washcloth that will be used by the physician to hold the scope, emesis or kidney basin for water that can be used to rinse or flush the scope, a large 60 cc syringe that is used to flush water and flush the suction channel, and finally the dirty scope label so that you could put the label in and take it back after the procedure ends. And this is important so that people do not mistake for a clean scope and a dirty scope. Next, you open the cover of the clean scope container and remove the endoscope, and then go to the endoscopy tower and attach the light guide end of the scope, the umbilical cord, to the processor. And once you attach, you go back to the table and pick up the suction button, air water button, biopsy cap, and fix them to the appropriate places. Next, you take the auxiliary water jet connector, pick it up, and attach it to the auxiliary water jet valve. So this is the this is the area that shows different connectors. You need to connect the scope to water supply, air supply connector on the left side, auxiliary water jet connector with a tubing, and suction connector with a suction tubing. Let us see how this works out. So air water connector connected, suction connected, auxiliary water jet connected. So let us look at this thing in a little more detail here, the different tubings that are connected to the scope. Next, power on the CO2 machine, auxiliary water jet machine, and then you look at the processor. There are multiple buttons: power on, air, lamp, transillumination, brightness, and the lamp life buttons. So once you connected the scope to different tubings, next you go on and put the power on, followed by air or CO2 depending upon what you're doing. If you're planning to use CO2, keep the air on standby, and depending upon how much of air you want to use, you can press low, medium, or high, and then turn on the lamp. Usually the lamp is on standby. When you press the button, it gets turned on, and you can check whether the lamp is on or not by checking at the screen. So now the scope is ready. There are a couple more steps that you need to do to make sure that your system is set up right. You want to press on the suction button to suction first water and then air, and then you want to check the air water button by pressing on the air and seeing bubbles coming out, and pressing it down further to see the lens cleaning fluid coming out. So now the scope is set up. You want to get the patient ready. For upper GI endoscopy, it's important to place the bite block. So pick up the bite block and then insert it in between the teeth and secure it. Next, pick up the large towel and place it under the patient's head for comfort. And once this is all done, you are set to assist the endoscopist with the procedure, and the procedure begins. As you can see, there are a lot of steps, but trying to understand what is required and how to go about it and how you define your own workflow is critical, so that you have a very smooth, clean workflow that is practiced again and again. Thank you.